Now that the longest ever US government shutdown is over, let's talk about what they're not telling you. No, we're not going to talk about the Mark Epstein email thread asking if Putin has a photo of Trump giving Bubba fellatio. It's that 22 million Americans are about to lose affordable health care because Congress refused to extend ACA subsidies, and Americans' healthcare premiums could double or even triple in 6 weeks. I mean, where's Luigi? Meanwhile, 1.1 million American workers lost jobs this year, and billionaires in the US made over $698 billion. I saw this playbook when I worked at Tesla. Here's how they just choose billionaires over you and something we can do about it. Let's talk about what actually just happened. After 43 days, the longest government shutdown in US history ended. Congress passed a continuing resolution funding the government through January 30th, 2026. However, they refused to extend subsidies for the Affordable Care Act, the ACA. 8 Democratic senators caved and agreed to end the shutdown without protecting people's health care. This was them choosing billionaires over 22 million Americans. The shutdown was not a resolution. The timing of the Epstein email release and the vote to end the shutdown is really interesting to me, but I'm not going to speculate on it. What I also won't do is trust and believe that they will extend the subsidies in mid-December rather than doing it right now, especially considering their recess is planned to begin on December 22nd. And one thing I know about Americans is that we take our Christmas breaks seriously. Here's what all of this means for real people. 24 million Americans have ACA marketplace insurance. 93% of them, 22 million people, receive subsidies, making coverage affordable. Those subsidies expire December 31st this year. That's 6 weeks from now. Out extension, premiums will double or triple starting January 2026. A family of four making $66,000, 205% of the poverty level, will see a marketplace premium rise of $121 to $373 monthly. That's an annual increase of about $3,025. I understand that a lot of people think that Americans earn more than in other places, but that's true if you just look at it on its face. But you have to realize the monthly costs that come with being American, most notably healthcare. What you have to realize is that the monthly premiums that people pay don't actually cover their service. There's still co-payments that they have to pay when they have a medical care visit. You pay the doctor or the facility an additional fee just for extending the care. If subsidies aren't extended, nearly 5 million people will lose their healthcare coverage entirely, all because they can't afford to keep it. And the thing is, this crisis is manufactured, but it has human consequences. All this is happening while 1.1 million workers lost their jobs in 2025. This is a 65% increase over last year. All that, and somehow billionaires managed to gain $698 billion this year, while the IRS team that audits billionaires lost 38% of its staff. So we're in for less oversight on the wealthy. Congress says we can't afford $60 billion for healthcare subsidies, but they protect 698 billion in billionaire wealth gains. But I guess everything is just working exactly as it was designed. They let the subsidies expire because extending them for 2 years would cost over 55 billion. They say we can't afford it, but billionaires gained 698 billion so far this year alone. That's more than 12 times the cost of funding ACA subsidies. The money exists. They don't want to tax billionaires to fund healthcare. Who profits when subsidies expire? Insurance companies can charge higher premiums. Pharmaceutical companies face less negotiating pressure. Healthcare corporations benefit from the uninsured using expensive emergency care. Billionaire shareholders in these companies get richer. According to OpenSecrets.com, the insurance industry has spent over $130 million on lobbying in 2025. Pharmaceutical companies, they spent $341 million. They're getting exactly what they paid for. We're in this perfect storm for workers. Layoffs in 2025 is the second highest since 2009. Over 1 million jobs are gone. Over the last month, we've seen more. UPS cuts 48,000 jobs, Nestle cuts 16,000 jobs, Verizon cuts 15,000 jobs, Amazon cuts 14,000 jobs, Accenture cuts 11,000 jobs. As always, I've linked the articles used in this video. This one it tracks layoffs and hiring freezes in the US in 2025. It lays them out really clearly. In the US, when you lose your job, you lose access to employer health care. Now the ACA marketplace is becoming more affordable too. Workers are getting trapped between unemployment and unaffordable health care. At Tesla, I watched workers get laid off and lose health care simultaneously. I waited years for my turn. And when my turn finally came, the most affordable COBRA rate was $1,321.29 a month. COBRA is the Consolidated Omnibus Budget Reconciliation Act. This federal law lets eligible workers and their families temporarily continue their group health insurance after a job loss. $1,321 is the cheapest monthly rate I was offered for my family when I no longer had a paycheck. Imagine what happens when a family has to choose between rent and insulin. It's disgusting and it's by design. Meanwhile, billionaire wealth is protected. The unit that audits billionaires lost 38% of its staff in 2025. Less enforcement means more tax avoidance. Billionaires, they use that buy, borrow, die strategy to pay zero taxes on their wealth gains. That untaxed $698 billion could fund healthcare subsidies for 11 years. Instead, 22 million Americans lose affordable healthcare coverage. The system protects billionaire wealth while denying workers healthcare. This is a wealth extraction that's disguised as fiscal responsibility. I saw this pattern while I was at Tesla. Healthcare tied to employment is a control mechanism. Workers are afraid to leave bad jobs because they need coverage. Companies use this fear to suppress wages and working conditions. And then when layoffs happen, workers lose healthcare at their most vulnerable moment. I watched colleagues stay in toxic situations because they couldn't risk losing health insurance for their kids. Tesla posted record profits while laying off high performers, an executive compensation package worth billions. Workers who were fired via email or badges were not working when they arrived to work. They lost salary and healthcare simultaneously. Elon's net worth increased by billions while workers lost everything. This system extracts from workers and concentrates wealth at the top. When I moved to Spain, I was able to afford private healthcare without a job. Here, healthcare is a human right, not an employment benefit. I paid 80 euros a month for comprehensive coverage, no deductibles, no fear of bankruptcy from medical bills. It's a reminder that the American system isn't broken. It's designed this way. It keeps workers desperate. Here's why Congress chose billionaires over 22 million Americans. Check the donors list of the 8 Democratic senators who caved. Donations from the healthcare industry go to both parties. Politicians protect their donors over their constituents. And it's legal. They created this crisis. These subsidies did not need to expire. They did not need to expire now. It's an artificial deadline that they created. And now they have leverage for tough choices between competing priorities. They use these crises as justification for cutting programs that help people. Meanwhile, billionaire tax loopholes are prioritized. When you look at this all together, you realize that a healthcare crisis, mass layoffs, and a billionaire wealth explosion amount to a system working the way it was meant to. It's not a series of unrelated events. They are intentional policy choices that benefit the wealthy at the workers' expense. They say that we can't afford healthcare, but they protect the $698 billion in billionaire gains. Their priorities are clear. Once you see this pattern, you can't unsee it, and you shouldn't accept it as usual. ACA subsidies still can be extended before Congress goes on recess. I know it feels like a waste of time, but call your representatives daily. Use the 5 Calls app to make it easier. I've linked it in the video description. Let's make sure that we target the 8 Democratic senators who caved. Demand that they fix the mess that they made. Tell them to extend the ACA subsidies or I'm voting you out. And make this a voting issue. Talk about what's happening wherever you can. Frame it as tax billionaires so 22 million Americans don't lose their health care. 55 billion in subsidies is less than 8% of billionaire gains this year. Let's say you made it $1. It's less than 8 cents. We need more people talking about this. And I realize it's salacious to talk about the emails that came out from the Epstein estate, but personally, I don't think we will see the Trump files until somebody leaks them, like Manning or Snowden style. In my opinion, the people with the power to release the files without a leak, they won't, even with public pressure. So let's expose these people and make them choose publicly, billionaires or healthcare. I recently heard about a resource. It's called DCP Frontier. It's an initiative focused on supporting and expanding direct primary care in the United States. It's a healthcare model in which primary care providers contract directly with patients for a monthly or an annual fee. And it helps people bypass traditional insurance, and it provides unlimited access to basic primary care services for a flat fee. I've linked the page in the video description to help anybody who needs it. It's super easy to get caught up in all this negativity wherever you are. Still, I hope that you're taking it all in moderation. This week, I took a news and social media hiatus. Coming on back online was like a tsunami. I realized I was getting sucked into the darkness of everything that was going on. Somehow my YouTube feed had gotten inundated with suggestions from channels that compiled other people's posts and added commentary. As usual, I check who's behind what I'm watching, and I found a few who were actually driving narratives that feed people's fears while supporting the administration that's driving those fears. And I want to make sure you're not feeding your fears with these negative headlines, and that if you feel overwhelmed by all that's happening, take time out to do a reset. A news detox may just be what you need. Your concern may be that you want to make sure you know what's going on so that you can stay safe, but you can burn out and become ineffective if you're not careful. You should be a part of a community and tell them that you want to go on a news detox, and ask them if they can tell you anything important, anything that you need to know while you're signed off. If you're new here, I'm Kina. Thank you, Vera, for letting me know that my email address in my video description was missing the letter D. If you haven't visited my video descriptions before, yeah, my email is there. It's overwhelming to have so many emails come to my inbox. It's kind of triggering. It's because I got way too many emails at Tesla, but I'm happy to help anyone who needs it. Anyway, when I returned from my news detox, the first thing I did was open Ground News. I start with my For You page, and then I move to the local news and then the blind spot feed so I can see if there's something that I'm missing from my other feeds. I use the Vantage subscription, which gives me access to all of the features. Feel free to use my link in the description if you want to get 40% off of the Vantage plan. Thank you so much for buying me a coffee. You are the reason I keep going. If you haven't already, like this video to help me out with the algorithm, and I'll see you in this video right here. Okay, bye.